Resilience through autonomy, ensuring dignity and quality care in sexual and reproductive health. Welcome to The Pulse with Dr. T. My name is Dr. Tlaleng Mofokeng, and it's such a privilege to be back on Pulse with Dr. T at this crucial moment for the community as we come together to celebrate World Contraception Day. It is so important to continue to talk about the power of family planning in shaping lives and, of course, advancing reproductive health. ICFP 2025 is also just around the corner. We are on the road to Bogotá, and I challenge you to join this amazing community of activists, of researchers, of service providers, of communicators as we come together as the SRHR champions to create a more resilient and equitable global health system. And today I am joined by such amazing young people who will be sharing with us their insights in terms of their own journey in the process of family planning practitioners, as researchers, as legal experts, and of course, as people who themselves require family planning services. We are, of course, having this conversation in a world that is faced with multiple crises. But it is important to underscore that autonomy and dignity and quality care remain essential in strengthening resilience within the SRHR landscape. And to talk with me through this virtual roundtable is Tlaleng, who will be focusing on legal frameworks and human rights advocacy, as well as Isabel, who will focus on gender perspectives in SRHR policy and advocacy, as well as Naomi, who has a focus and a really formidable experience in grassroots mobilization and service delivery in underserviced communities. And by no means least, Kerigo, who will be focusing on obstetric violence and respectful maternity care. And so I welcome you to The Pulse with Dr. T as we celebrate World Contraception Day in this conversation as we carry forward the message of resilience through equitable global health systems. Without wasting any more time, I want to start by first giving Tlaleng, of course, a moment to start the conversation and share with us her work, her experiences, and what she brings to us as the ICFP community on this World Contraception Day as we deal with so many crises around the world. What does autonomy, dignity, and quality care look like for her in her area of work? So Tlaleng, welcome, and the floor is yours.
Thank you. Thank you, Dr. T. Hi, everybody. I'm super excited to be here, and thank you again for the invitation. I know it's no secret, but obviously you are one of my favorite people on earth. So I'm super excited to be here, but with all of you as well. As some of you may know, I'm a scholar activist and human rights practitioner, and do research and legal advocacy at the intersection of gender equality, human rights, but obviously with a particular focus on sexual and reproductive health and rights, variety of issues, whether that's abortion, contraception, comprehensive sexuality education that we recently did research on, and I'm hoping to also speak a little bit about my work, but especially as it relates to the theme of the theme, rather, especially around the intersection of autonomy, dignity, and quality care. It is really central to the work that I do. As I said, as a scholar, I am particularly interested in how I can generate evidence, especially for the advocacy that incredible people, incredible activists, women rights activists, feminist activists, global health activists do on the ground to push the agenda as well. So super excited again to be here and looking forward to discussing all these issues with my fellow distinguished panelists as well. Thank you for having me again.
And of course, I know a lot of your work, and I was involved in launching your book that you had written, of course, based on your experiences that you had in South Africa. And I think one of the most important, points for me, especially for young women and young activists everywhere, is that we do need to write. We need to write about experiences. We need to put on paper our intellectual work, because this is how we actually have impact and broaden our impact. But often what makes other people see that they are not alone in this world, right? In the challenges that they face. So thank you very much, Tlaleng. And I'm gonna now jump to Isabel and ask you, Isabel, to share with us as well from your experiences on advocacy and, of course, the gender perspectives in sexual and reproductive health policy and some of the work that you've been doing in terms of research.
Thank you so much for having me. I'm so happy to share this space with you this time and to learn from all of you. And also, I think there are like many regional stuff that we can talk about and like learn from each other. So thank you for this opportunity. In my work as a legal advocate, I think I have had the opportunity to work as a public servant and also in different NGOs. So I think that combined experience has like taught me a lot about how to collaborate and how to form strategic alliances. I studied the master's in national and global health law last year, and also like learning from other regions and like working on research with Dr. T and working for the research specifically in strategic litigation. It has been like more obvious for me how learning from other experiences is very important, and also like what you were saying about writing, reading about those experiences like brings a lot of light to my work and how to like create new strategies. So in these two experiences that I was mentioning as a public servant, my work was also very oriented to like make training materials and like participating as a trainer for judges and other judiciary officers. And even when it was like all public service related, it was my intention and our intention, like informing these materials, was always like to bring the gender perspective part of it, even in cases that were not typically concerning like sexual and reproductive rights, health issues, but like that can be seen as other rights, like right to information, trying to bring the integrative perspective on them. So yeah, I think like creating research materials, trainings, and also like leading legal strategies have been like a very important part of my work as a legal advocate. And I think that term is very useful to describe like careers like ours, because I was like reading your bios and I think they are very broad on what you do, because you are trying like to bring the opportunities and to shed light on things that are there and that you have the expertise like just to put them together. So I think it's a very useful term to think about our work. So thank you so much for having me.
Thank you. And Naomi, I was just with you in Liberia, and you know how much I love your country, your people, but also the important work that you do in Liberia. And you have not just a personal story of resilience, but one that has gone to benefit and literally ripple through the community in how you have gone from being a young person who went through what they went through and needed services to being, a nurse midwife and now a leader in her own right in this space. So take us through what it has been like to be working. Often we say where the rubber meets the tire, right? And being service delivery in often underserviced communities.
Thank you, Dr. T. It is a pleasure always to share amazing platform with you, and especially with all the amazing women who you have selected, your people. So I know this is our people, so I'm happy to be here and just unlearn and learn together. So yes, you are just here in Liberia, and you know the context in Liberia, an underserved country like Liberia, where we as young women grew up and experienced the harsh reality of lack of basic health care services, and we grew into it, normalizing it as if something was normal, till we started to work and we saw that it became a vicious cycle where other young women coming after us experiencing the same challenges. And we decided that there should be one time in our life where we need to put a stop to these unqualified healthcare services, lack of quality health services, where we are being judged by our own choices that we make. So what we have been able to do, especially in Liberia, in the context, is to work directly with the community people, where we realize that there is a big lack of trust between the community and the health services. So because of that lack of trust, there is an under-representation of young people, of women seeking quality healthcare services, even to community where it is afforded to them, because they believe that when they go to the health services, there is not a trained health practitioner. If there's a trained health practitioner, there is not access to commodity is not available, medication is out of stock. So what we have been able to do is that, and using just the common and natural biological process, which is menstrual hygiene management, right? Where we have been demonized, we have been conditioned that this is not normal to see your period, and it has affected thousands of women and girls globally. So what we are being able to do is to work with local structure and see how we can find local innovation that they are part of. So by making community part of the intervention that respond to their needs, actually create a space of trust. It makes them feel that they are part of the system, they own it. So it's that sort of ownership that this is what we want, and it is being done along with us. So like the our Power for Girls project, where we launched, where we work with women in local communities, women in incarceration, where access to reproductive health services is really, really limited to them, and working along with them so we all define or we all discover what are the innovative way where we can be able to address whether it's menstrual health, whether it's access to contraceptive, whether it's access to comprehensive abortion services, how we, when I say me, like women, girls who are affected by lack of these services can come up with innovative way, and we propose and work towards ensuring that these services are available, accessible, and affordable to us at all times. So yeah, with all the challenges that we face, we are finding local solution, and we believe that local solution is the way around quality healthcare services, because community own the whole innovation. They feel they are part of it, and they can be able to hold system accountable because they understand how it should look like and how it should respond to the specific needs. Thank you, Dr. T.
And you've put us in a beautiful way into what Kerigo will be sharing with us, because often we know what we don't want. We know what goes wrong in health systems. And I think it's important to also to start articulating what it is that we want. So the idea of this respectful maternity care and how that has been something that we keep talking about a lot now, reproductive justice, autonomy. And Kerigo, your work has been even now as you're doing your PhD on obstetric violence, and then also, of course, respectful maternity care. Can you take us then through what those mean? And therefore, for this particular conversation of dignity and quality care for anyone who can be pregnant, what does it mean and what does it look like?
Thank you so much, Dr. T. It's always a pleasure having a conversation with you. And again, I'm very excited to meet all the distinguished people here. Dr. Tlaleng Mofokeng, a very dear friend and my supervisor. So it's always very good to engage with her. And just to echo one thing that Isabel said that really resonated with me is that for many of us, we do a lot of things, right? We are not one thing. We are researchers, we are advocates, we are lawyers or medical practitioners. And that is very, very important because it basically is a reflection of what we are all working on sexual and reproductive rights. That all these things are intersectional, from CAC to abortion, to the rights of medical service providers, as well as the rights of patients, and now the rights of pregnant persons when they navigate facility-based care that I work on. So my research has primarily been on issues around respectful maternity care, particularly those that pertain to informed consent procedures. And the reason why I've been focusing on it is that there's a lot of jurisprudence, so there's a lot of research, right, that is coming out, documenting the kind of practices that are going on in very many health facilities throughout the continent. Right? Because what we are seeing is that quite often, because many pregnant persons don't even know their rights, they don't even know what they're supposed to receive. They don't know when their rights are being violated. And this is just not something that affects pregnant persons. Even when it comes to adolescents, for instance, just negotiating health services to seek reproductive health care, there are a lot of things that happen there, right from stigma or just them being told, why are you here to seek contraceptive services, right? You are young, why are you, what do you need contraception for? So when I'm looking at issues around respectful maternity care, yes, from an academic perspective, it's just on that element, but then it is a reflection of the overarching situation in the reproductive system that is prominent in most African countries, that the issue of autonomy and individuals' ability to decide what it is they want to do with their own persons is problematic, simply because
the way historically medicine has been taught. And this is no offense to medical practitioners, right? Because even the medical texts show this, that medicine was not designed to actually take into consideration that the users of services are actually individuals that have rights and can decide, okay, this is what I want. It is something that we've progressively learned, with now the question of bodily autonomy, dignity coming into the conversation, to ensure that we now have a situation where we're shifting from physician-centered care to patient-centered care, where we center what exactly is essential to ensure that we safeguard and we protect the rights of persons such that they get services in a dignified manner. And that's why we, and as feminists, scholars, researchers, and advocates, are now raising awareness on issues of obstetric violence, because we are calling it violence in that, to a huge extent, it is an intentional violations of rights of people when they come to seek care. Why do you forcefully sterilize someone? Why do you subject somebody to forced contraceptive services? So all these things, as we are talking about sexual and reproductive rights, they're part of the same ecosystem that creates a very an enabling environment for violations to occur. So it's very good that we are having this conversation within the context of family planning now, to just bring that thread across all these things that we know are prominent in SRHR provision services in Africa and across the globe. Thank you.
No, that's great. And you guys have been, giving me a lot of insights. And I will say, as a physician myself, I fully agree that we need to move from physician or doctor-centered approaches in clinical care. And that's perhaps why I'm an activist, right, as a medical doctor. It's precisely because of that knowledge and that experience of having, been firstly a young person who needed services, but also a medical student at the same time, and realizing how difficult it was, even for me, with that scientific knowledge, with that privilege, right, of being within the system. And so I think it's really, really important to get back to our theme of today, which is resilience through autonomy. And all of you, in some ways, have articulated the importance of that. And dignity is a very central theme for me because it's very personal. And you guys have described it in many different ways, because you have to ask someone what a dignified quality care looks like. You can't prescribe it for them. And that allows us to actually listen to what people want. It allows us to listen what our clients want, what our patients want, what the young adolescent women want. And so in that spirit, I will go back to Satang and ask you, what do you think, therefore, in terms of legal frameworks, can strengthen resilience by safeguarding rights?
Thanks for that question. And to re-echo, I think everybody's earlier point as well, that all the things that we work on are connected as well. And so when we're really thinking about legal frameworks, as well as human rights advocacy, really is looking at both human rights instruments at the international level, at the national level, at the regional level, and how that sorts of really speaks to especially around issues of non-discrimination, but also human dignity as well. Obviously, as you rightly said, human dignity is very central, especially through the theme of contraception itself, right? Because really what we're talking about is not just about birth control. It is a vital tool. We know that contraception, family planning is a vital tool for gender equality. It is a vital tool for promoting positive health outcomes as well. And so that is why, for instance, and I wouldn't really label the whole idea around sexual and reproductive health and rights being a right, because we all know, especially those on the call, but also perhaps those that will engage as well. But we know that sexual and reproductive health and rights, including the right to contraception, has been codified both at the international level, but also regionally, sometimes nationally as well, depending on what that looks like. So part of the work that I have done, especially at the African regional system, has really focused around building up the normative framework, right? So that includes obviously drafting norms standards, including various general comments that have been adopted by the African Commission, but also the African Committee of Experts on the Rights and Welfare of the Child, but also quite a bit of work, especially in terms of thinking more strategically how we can influence legal reform that aligns with international and regional human rights standards, right? I mean, the reality is in most of our countries, especially those that you will call the global south or the global majority, we know that we do like our laws. As a lawyer, I know that the laws are very important. It is important as a legal framework, as a basic framework, right, to support the work that we do as human rights activists, the work that we do, in relation to being able to hold government accountable for their obligations under international human rights standards as well. But we also know that the reality is that, especially with, and the global health structure, with the way international cooperation works, sometimes our governments ratify and do things just to tick off the box, just to be seen to be saying, oh, we're doing well, right? But also, I think also acknowledging as well that there are also structural challenges as well, even with countries with more progressive legal frameworks. So as you rightly said, the research that I've been doing in South Africa, and again, thank you for writing the foreword and launching my book, A Plug, Choice and Conscience, Lessons from South Africa for a Global Debate, Open Access on Consensus Objection, for instance, is one of the key barriers as it relates to thinking about challenges, especially as it relates to positive legal frameworks. We know that in countries like Kenya, we've also had very progressive jurisprudence coming out of the courts, especially as it relates to issues of abortion. And for instance, back in 2022, just before the Dobbs decision, Kenya has a positive jurisprudence really thinking about the need for medical abortion, but also particularly as it relates to how we address ambiguous legal frameworks. Because even as we think about that the African region, in particular, the African countries are making progress both in relation to decriminalizing FGM, but also criminalizing abortion as well, but also in relation to other areas, the national policies that we have on family planning, as well as other policies, is also acknowledging that the structural barriers that the countries face as well has been a challenge. And so thinking more strategically in terms of how we push for legal reform, but also make sure that the law in action actually speaks to the needs of women and girls, particularly as it relates to abortion, as it relates to contraception, as it relates to comprehensive sexuality education, which, as I said, I think part of what we've also seen as well is just this general backlash, gender backlash, not only in the region, but also in Latin America, but also in other parts of the world, right? Where there is a connection there showcasing that conservative actors in the global north obviously has connections with conservative actors in Africa. Kerigo is here. We did a fantastic case study, if I can say so myself, looking at the linkages between conservative actors in Kenya, in Ghana, in South Africa, with conservative actors in the global south. And part of really what comes out is, despite the fact that, as I said, we have progressive legal frameworks, that we also are seeing actively how the anti-SRHR movement and actors are really coming together to strategically think about how to roll back on gains made as well. And so this is really where, for instance, thinking more strategically about really resilience, thinking more strategically about how we utilize strategic litigation, but also beyond that as well, especially thinking about some of these issues as well, I think are vital as well. But I'll stop here a little bit. I'm sure others have other ideas, and then I'll come back to thinking about these issues more as well. Thanks.
And I think, Isabel, perhaps maybe you can come in here around the judiciary and why it's important to also, include training of the judiciary in gender justice, but also ensuring that they, uphold reproductive rights. And I say this because we know that globally, access to contraception is becoming difficult because of legal barriers. But we also know that everyday discrimination, right, that women who are immigrants with disabilities, LGBTQA plus women, women who are poor, right, have a particular difficulty with accessing care. And it's often through the use of courts or other, legal ways that they can be afforded services. So in your experience, in some of the analysis that you've done, can you share then with us, Isabel, the idea that the training of judiciary and the judicial system is important in the same way we think about physicians and how we need to train physicians to be better in terms of human rights, but specifically reproductive rights.
Yeah, of course. Thank you so much for everything you say, Satang. Like many of those things resonated a lot with what I have been researching for the strategic litigation project. And just a little before going into the judiciary training, what you were saying about attending like the needs instead of just focusing on the legal reforms, I think that part in Latin America has been like such a like underlooked but very important thing, because even like when legal equality has been advancing a lot during the last decade or more, I don't know, we are like most of I wouldn't say most, but a lot of countries like Colombia, Argentina, Mexico have been like granting access to abortion in the paper, but not actually in real life. And there is still like a lot of political or very tense discussions about it, with local governments trying to like go back and pushing back the decisions of the Supreme Court. Because fortunately in Mexico, for example, the Supreme Court has been like a very important actor to like guarantee rights for women in general, but also specifically about abortion and access to contraception and the prohibition of underage marriage. Topics like that have been advanced specifically in the judiciary and not in the Congress. So definitely like having an independent judiciary and like having a judiciary that is trained, that is like focused on like advancing rights, has been important. And it's not only about the legal reforms, but about the actual progress in the topic, that it's made not only in the law, but also in the policy and how you interpret the policy. And that made me think about something that I found out in my research on the topic for Mexico. There is this program, Attending Teenage Pregnancy, that was launched in 2012, and it had a lot of resources, like because Mexico is the second place in teenage pregnancy in Latin America, just after Colombia. So the thing is that we have this Ministry of like Development, and they focus all the resources and all the energy like in pushing forward like narratives about how to access to contraception. But when I was reading like some analysis of the program was not actually attending to the real needs in like a matter of communications, how to communicate this to the different populations in Mexico, to rural Mexico, to urban Mexico, to different incomes Mexico. So the outcomes haven't been as high as they could have been if the policy would have been like designed in conjunction with civil society, with other stakeholders. So I think the collaboration part is like something that is lacking, that maybe the judiciary is like going one way and the Congress are going other ways, like local and federal Congress. And also even the executive power, like by itself designing policy, is not like paying attention to the actual needs, but specifically to they are seeing the right on paper, but not thinking about how to actually implement it in a context of like to make form resilience, as we were talking. Like I think in this kind of policies, for example, it's really important to engage teenagers and like to create the policy to design it with them. So the outcomes of that program haven't been like as good as they were expecting, even when there was a lot of resources, like institutions like the World Bank have been like investing a lot on the matter, and it's just not I think as long as you are not attending to the population you are focusing on, and like actively listening and like designing it with them, it's easy like to not achieve the outcomes you are looking for, but also you are more exposed to backlash. In the research too, I found a very interesting paper from Women Link Worldwide in Colombia. They were talking about two cases in sexual and reproductive rights litigation. And one of them was against one public servant who was a very conservative person, and he took the office of the general prosecutor. So when he took the office, he was pushing back some advancements that were made through the court. So it was a very interesting litigation because like they were talking about how his actions were obstaculizing the access to information, the right to information. And the framing, it was like more about how the access to health was being obstaculized by these statements, because he was providing false information about misoprostol, or like the pill for the next day. So he was like deterring people from using them, even being a public servant. So they framed the problem as a problem of access to justice, and not only as a problem of like gender equity, which was very useful, because then the court like ordered him to stop and to release declarations where he was acknowledging that he was providing false information, or information that was not medically like that was not based on medical evidence. So and regarding this, they analyzed this case with another one, saying that there are 4 important things that should be considered when you are doing a strategic litigation. One very important is having an independent and knowledge-level judiciary. And I'm coming back here like to the training of justices and other people who is involved in the providing of like medical services and sexual and reproductive health in general, on how if you don't have this base of people who you can come to with a problem, and they have the legal framework for that, not only based on like local regulations, but also a human rights approach to the topic. So that can make the entire difference on how you access to rights or not. And that's very clear for me in the US case, for example. So yeah, I think all of these things are very related, and also thinking again about how the legal advocacy has to be like focused on many different like parts of the process. It's important like to keep all of them in mind.
Yeah, thank you. And it gets me thinking now for accountability within the reproductive justice framework. And Kerigo, maybe you can come in here about what are some of the most promising strategies, right, around the promotion of autonomy and dignity in this particular context, where we know that we want, accessible, affordable, appropriate, and modern contraception choices for everyone who needs them, right? And that the courts take long, litigation is expensive. So what are other ways? What are some of the promising ways that you can share with us in terms of your own experience, and perhaps what it is that you will be, demanding in your PhD in terms of accountability for dignified treatment and care?
Yeah, thank you so much for that question. I like the question, especially because we've just come back from that conversation around the South-South dialogue on respect for maternity care and obstetric violence at the O'Neill Institute. And the question about accountability and justice is actually something that was very fundamental to that conversation that we had as people working on obstetric violence and respect for maternity care as a whole, because our point of departure was, what is justice to begin with? Who determines what justice is, and how does it look like? And how do you make sure that everybody feels like this is justice? So justice is very complicated and it is very subjective. However, there are certain bare minimums that we can actually strive for when we're talking about justice. So in the instance of obstetric violence and respect for maternity care, something like forced sterilization, the point we can start from, can we first of all acknowledge that these people have been wronged? It is a wrong that has been occasioned. It is a human rights violation, because some people just say, I want to be acknowledged. I want it to be known that I was violated, right? Then there's the issue of reparations and issues around compensation. That is it's one of those discussions that is actually very complicated, because how do you even quantify some of these human rights violations? But that does not mean that those who are supposed to be held liable should now just go scot-free. We need a framework where all relevant stakeholders come to the table and have a conversation around what we want to work towards in terms of a justice framework. So in my work on obstetric violence and respect for maternity care, right? Because obstetric violence is the violation. We are working towards respect for maternity care eventually. The idea or the approach that I believe is very promising in this particular area is that it's a multi-sectoral approach. We need to bring all those key players to the table. We need the medical service providers, we need the lawyers, we need the activists, we need the victims to come to the table. We need people, we need the government on board. We need people who are teaching, because all these things start from information that medical service providers are given when they are being taught medicine? Can we look at changing curriculums, right? The curricula that people use, medical students are taken through? Can we have human rights being properly trained to them? Can we have situations where they are actually taught how issues around abortion? Because if I'm not wrong, I did hear that there are places where they're not taught how to provide abortion services as medical service providers. So when you bring all these people to the table, it starts from a point of, let's first of all understand each other, that look, we are not here to fight each other. Because yes, as a lawyer, I will seek legal recourse through the justice system, because eventually these are rights that are being violated and somebody must be held to account. But that does not mean that I want to antagonize or vilify a medical service provider. Eventually, we are all looking at how can we use the mechanisms that are available to us to actually change the system. And quite often, the reason why lawyers end up litigating on obstetric violence is because there's a breakdown in communication somewhere where somebody does not want to even acknowledge that there's a violation that has happened, right? Mm-hmm. And then once we've even used or explored the judicial mechanisms that are there, the other question that now we find ourselves with is implementation. You get decisions that are coming out of the court, but then implementation, the buck stops with the government, where they'll say, okay, fine, the decision has come, we are supposed to do 1, 2, 3, 4, 5. Then they tell you they don't have money, because unfortunately, the realization of sexual and reproductive rights requires a lot of money being pumped into it. But is it a question of they don't have money, or they have just not prioritized money? And that's why I always say I'm a money person. I will always say I love money when it comes to these conversations, because we cannot realize reproductive rights without financing. All these things require money to be pumped into. Right from medicals, let me just talk about medical service providers, because I feel like they have been vilified a lot. Let me speak a bit on their side. Because they will tell you they're overworked, underpaid. One person is supposed to man 50 beds. Definitely somebody somewhere in that chain is going to suffer, right? You cannot have a strained medical service provider who's definitely also being violated. And like today, I think yesterday, sadly, a medical intern committed suicide in Kenya because they couldn't take it anymore. So what we must start looking at the systemic issues that form part of the cyclic situation that we found ourselves in, where violations that keep on occurring, we keep on transferring, and it's now a domino effect. So I will stop there because I could go on and on. But then for me, it's can we find a framework that brings all of us together to the table to have a conversation that is geared towards building a system, or building sustainable systems that actually respond to the needs of the people that we seek to serve. Otherwise, we will keep on fighting one another and we are not going to move forward.
I think you've already given us a lot of work as we do the work and the road leading up to Bogotá ICFP 2025. About some of these conversations, both during the week conference, but I think also in the pre-conference days. And you've said something really important about bringing all the stakeholders around the table. And I still think ICFP remains not just the biggest scientific conference on this issue of family planning, but also one that brings around some of the most vibrant, fiercest advocates in the world together. And so with that experience and that, Bogotá in mind, Naomi, I want to ask you, in this ongoing world of global multiple crises, whether it's the climate, whether it's pandemics, whether it's protracted war and conflicts around the world, we know that one of the first services to often feel the brunt is sexual and reproductive health services. And young people, young women specifically, face a lot of challenges. And unfortunately, the system demands resilience out of them, even at that early age where they should just be young people and free and happy and joyous, right? And experiencing life. But because of these challenges, we know that they tend to also then have to build in that resilience. So from your perspective, any regional or international collaborations that you've been part of that have contributed to some extent to bringing dignity and autonomy and quality care back as a pillar that's really important for SRHR.
Thank you, Dr. T. When you talk about regional network, there are so many regional networks, and every time I say as an activist, I get frustrated. In as much as I know I got the lawyer here, if it's not on the book, you cannot hold anybody accountable. But I think in Africa as a whole, on this continent, we are good at either signing in legislations, we are good in doing policy, strategic plans, but what is lacking is the implementation and who monitors and who reports. So we can have all of the beautiful framework around reproductive justice, around sexual reproductive health and rights, access to young people. We can shout young people need to lead right now. It's about the young people. But if we are not monitoring, if we are not documenting and reporting the quality of services, the availability of those services, and the affordability of the services, we are just going to be doing, we are just going to be not walking the talk, but just having all of those nice frameworks that are not being implemented. And I would say that for me, in terms of where do I see advocacy, where do I see networks moving, I want to see them at the community level. I want to see community, I want to see a transformative community. I want to see young people at the leadership leading the change that is so desired as it relates to sexual reproductive health and rights. Until we can achieve that on this continent, we are still going to have an increase in maternal mortality. We're still going to see people not, children being born and not seeing the first 5 days or just 24 hours on Earth. We are going to see young people being denied body autonomy, and they feel so frustrated. And at the end of the day, there's an increase, there's a wave of suicide coming to Africa that we are not accustomed to. Why? We need to investigate and ask what happened, what is happening. Because we are not shifting the power the way we need to shift it. We need to be intentional in ensuring that when we shift the power, we need to walk the talk. We need to ensure that women have control over the reproductive health and rights. They are making informed choices. They can negotiate the quality of services they desire. And the only way you have negotiating power, you need to have access to resources, and you need to be knowledgeable about what is the quality of services that's supposed to be provided to you. If you don't know the quality of services and your rights as it relates to those quality of services, you are going to sit down in the way we have been conditioned that the medical professional, as I'm a nurse, I'm a midwife, but the power that is being shifted to us to make decisions about people's life is something ourselves need to interrogate. Because we misuse the power so many times, we make decisions for people based on our own religious, traditional belief, based on our own biases, and because we feel that we are the professional in that space, we are like demigods. So in terms of us talking about shifting, ensuring that where we have global platform, like we are here on the Plus, we have all of those big global networks that talk about reproductive rights. It is good to have movement. Movement building is key. But what is also key is that we need to transition from movement building to actual practice. We need to see the shift. The data need to change. The data need to improve. And this improvement, we need to see people's life be improved. We need to see people making informed decisions, young person, people with different gender preference, not non-judgmental. We need to see that transition, then to push for policy. Policy is good. Currently in Liberia, we are pushing for access to safe abortion here. But one of the things I just said into this meeting, I'm like, in as much as we are pushing for abortion care holistically, let us start to ensure that the little leverage that we have around abortion care is being implemented now. The little leverage we have is not even implemented yet. So why we have our lawmakers taking control of our anatomy, let us make use of what are the leverage we have right now. By implementing that leverage, we are sure that once the law is passed, it will be implemented. We can monitor it, we can report on it, and we can document it. So I think in terms of movement building around sexual reproductive health and rights, reproductive justice, we need to move from policy to practice, and we need to ensure that we are shifting the power in a way where young people, women, girls, boys are taking informed, gender minorities are making informed decisions, and they are being non-judgmental, and the services are available, accessible to them, and no one is demanding as a demigod, as a service provider, and making their decision instead of them. So yeah, that's how I see in terms of the shift. Thank you, Dr. T.
Thank you so much. And in closing, I want to hear from each of you one word, a positive word that's forward-looking, that's going to get us around and energized as we think about World Contraception Day of 2024. But as we look forward to ICFP 2025 in Bogotá, as we know that that road starts this year, it starts now, and we will be building this community of ICFP. We will be continuing with our advocacy. So how do we then, with one word, starting with you, Isabel, what is your word for World Contraception Day 2024?
My word would be collaboration. Keeping us together, like keep talking, keep writing, keep like sharing our experiences and learning from each other.
Nice. And for you, Satang, what's your one word?
Can I break the rules and do 2 words?
Yes.
Okay, intersectional organizing. And we could spend the whole day just talking about that, but it is really, really relevant that we think more strategic, around collaborations, especially across regions as well, because what we're seeing with the anti-gender backlash, what we're seeing with the anti-rights movement, it is critical that we think beyond our own siloed expertise, beyond our own siloed experiences, to see that these things are interconnected as well. Thanks.
Great. And to you, Kerigo, what is your word or words?
Depoliticize.
Depoliticize. Okay, nice. And to you, Naomi, what is your word?
Build local ownership. Nothing for us, we are us. Yeah.
Love that. And thank you so much to my favorite panelists for joining me around this important theme of catalysts for resilience, autonomy, dignity, and quality care in sexual and reproductive health. And as we've heard from all of our insights, we know that globally more women and their partners are using contraception methods than ever before. However, despite this progress, we know that it's important to extend family planning methods to be more modern, to ensure that access is, of course, equitable, and that we enable more people to be able to make decisions around their health. It is important to have meaningful participation, information to enable informed consent, and of course, all of us are working together as the ICFP 2025 community in this road to Bogotá to ensure that we create systems everywhere around the world where everyone has equal opportunity to realizing their right to sexual and reproductive health. Through this theme of this year, Catalysts for Resilience, Autonomy, Dignity, and Quality Care in Sexual and Reproductive Health, I urge all of us to continue to be champions to creating more resilient communities and equitable global health systems. And I'm particularly encouraged by these conversations that we've had today as the road leads to Bogotá for ICFP 2025. I'm incredibly excited to be back on your screens as Dr. T to be taking these conversations forward with you. Thank you very much for joining me.
Thank you.
Thank you.